Okay, we're live. Welcome everyone to our chat today with Bruin Health. My name's Dani Brown. I'm the partnerships lead at Hint Health, and I am joined today by Arielle. Thanks for being here with us. We're so excited to. We had quite an interest in this live stream, so this is good. We've got probably a lot of viewers watching with us today, but thanks for being here. You want to give an intro on yourself?
Yeah, I'm happy to. And thank you so much for having us. We're really excited to be sharing about Bruin Health with the Hint community and really finding such a really nice fit within DPC. So really excited about this partnership. So I'm Arielle Radin Pulverman. I have my Ph.D. in health psychology, and I'm also the co-founder and co-CEO of Bruin Health. And in terms of health psychology, I'm an expert in how our mental and physical health interact and influence one another. And actually, throughout my PhD training, I had a side hustle where I worked for a digital health startup. And I actually found myself getting more and more excited by the idea of using technology to actually scale what we know in clinical research out into real world clinical care. So instead of continuing down this like academic path and becoming a professor, I decided to team up with my coworker, Andrew DeMichael, to start Bruin Health. And also, just like a side note, I'm a huge fan of DPC. I totally drank the Kool-Aid. My dad is an anesthesiologist, so I kind of grew up hearing all about how fragmented the healthcare system is and how much doctors pay the price for that. And I really do think that if DPC was around back when he was practicing, it would have made a huge difference for him. So not only do I feel like personally invested in DPC, but I also just see it as such a unique opportunity to really bring true integrated care into reality.
Absolutely. First of all, I love the side hustle. That's always, the true passions. Good things come from side hustles.
Yeah.
And also I love, cash pay anesthesiology. Let's go. Let's do it.
That's awesome. It'll happen eventually, I'm sure.
Yeah, exactly. So let's get into, you want to tell us kind of the more of the story on Bruin and just tell us more.
Yeah. So like I mentioned, I'm a health psychologist. So essentially, we know that everything going on up here is not separate from our bodies, right? But we have this unfortunate artifact of like 1500s dualism that has really created this completely separate system for mental health care outside of physical health care. And we know that that's problematic because chronic diseases are driven in large part by our mental and behavioral health, right? And we also know that physical health problems have psychological and behavioral impacts. So we really need to find a way to integrate mental and physical health care if we actually want to move the needle on overall human health. But that's really hard to do, right? And it's no wonder that mental health care has its own system because it's extremely complicated. I don't know if a lot of people know this, but there's so much shared symptomatology across mental health diagnoses that it's really hard to get an accurate diagnosis. It's really hard to know what's actually going on with a patient.
Tell us more about that. Like, shared symptoms. Tell us more about that.
Yeah. So there's what we call comorbidity, right? So it's very likely that if somebody has depression, they probably also have anxiety. And the problem with this kind of like symptom-based approach to diagnosing is that there are so many different ways that people can actually meet criteria for a diagnosis. So, for example, there are over 1,000 different ways that a patient could meet criteria for major depressive disorder.
Wow.
So that's a lot of different types of depression, right? But we're trying to treat depression as this like unified monolithic thing when we know, in fact, it's not.
Right. Right. And you and I we've talked about this previously, and we were talking about just right before, but I love so much how this fits in so well with DPC because the goals are aligned, right? And in the traditional fee-for-service model, there's just maybe not enough time to kind of get to the root of what's really going on and maybe treat it as, oh, that's a symptom. Let's, diagnose this as a kind of, let's write a prescription for that, or, maybe not taking the time that they want to or have.
Yeah.
And in DPC, they get a little bit more time because they're kind of in charge of how the patient relationship and the patient management is. So love this, how kind of the goals are aligning there, and keep going.
Absolutely. Yeah. And I think on top of that, it's like, even if we do have an idea of what's going on, actually knowing how best to treat those problems is also a challenge, because there's so many different types of therapies and different options. It's really hard to keep up to date on what's evidence-based. It really would require a doctor to basically have a whole other component of their training in mental health to be able to keep up with this. And then even further, there's this access problem. So let's say that even if you are an expert and you know exactly what your patient needs, where are they going to go to get that help? I think a lot of doctors feel this pain. It's like they have no idea where to get patients in for care.
Yeah. Right.
So it's a really complicated problem. And I think, unfortunately, our primary care doctors are really the ones shouldering all of that burden.
But primary care docs do it all. They
Yes,
do.
of course.
They do so much. But
Yes.
it's nice to have, right, when they want to kind of tap into some extra knowledge and resources. It's really great. That's why we love this partnership with Bruin, because I think so many of our docs and our practices are going to be really interested in being able to have this at their fingertips, right? When the time is right, they can just kind of use it when they need to.
Exactly. I think it's not, especially within DPC, I know that these doctors want to be treating mental health because they recognize that it's obviously playing a role in their patient's physical health. We've heard from our doctors that they feel that 90% of what they do really comes down to behavioral health concerns.
That's a big number.
Yeah. So
a really big number.
Yeah. So I think, unfortunately, they don't really have a choice. They need to be addressing this. I think they want to be addressing it because they have this really intimate relationship with their patients, but it's still extremely challenging. So we really wanted to figure out a way to bring that expertise into direct primary care clinics.
Yeah.
I think ideally what would happen is that every single DPC would have a psychologist down the hall.
Well, sure.
That sounds really nice. And then the psychologist would just, evaluate all their patients, figure out exactly what to do for them. But I think the
curbside consult, just
exactly,
at a moment's notice.
Yeah, I think that would be fantastic. But one, there just aren't enough psychologists and psychiatrists to go around. I think the last time I saw, we have about 100,000 providers short of what we need. So those people don't exist. And even if they did exist, like, that's so much overhead for a DPC to try to co-locate and have a psychologist in their clinic and actually make that happen financially. So it's just not very realistic. And so my co-founder, Andrew, and I really wanted to find a way to use technology to solve this problem. Unfortunately, when it comes to this like lack of specialists, it's a people problem. That's not going to scale. We need something that can scale, that brings this expertise into every single direct primary care clinic. And that's what Bruin is.
It's 2024. We can figure this out, right? Yeah.
Exactly.
So you're leveraging the technology that exists, right?
Yeah.
Let's bring it to every clinic. Let's have that curbside consult available, right?
Exactly. And I think what I'm really excited by is we know how important the therapeutic alliance is between a physician and their patient. And what's really cool is that because DPCs have such an intimate relationship and a personal relationship with their patients, I can't think of a better place to implement mental health care, right? Like that trust and that vulnerability is already there. So it's just a really appropriate place for those conversations to be had.
I agree. And I think, yes, our, all DPC docs, that's the relationship with their patients is everything, right? And same with the patients. That's why they're signed up with that DPC. And they have, like you said, the trust, and that relationship is just such a great place to really explore and kind of get down to what's really going on and work with them continuously, right? It's not just the diagnosis or, next. It's really working with them and continuing that care, right?
Yeah. And we've even heard our DPCs say that they feel like they are their patients' therapists a lot of the time, because they have this relationship with these patients. And, and I think that they want to be there for their patients, for their mental health. But again, they are not therapists. They're not psychiatrists. They didn't go into that area for a reason, right? That's not what they want to be doing. They want to be primary care doctors. So ideally they'd be able to address these concerns, show their patients that they care about mental health, they want to integrate it into their practice, but also have like a clear boundary there around what do I do as your provider versus where do I seek help for getting more expertise? Who do I work with to make sure that you're getting the right care you need? So I can really quarterback that care for you as opposed to like being your therapist.
Yeah, yeah. No, I like that. And honestly, my husband uses that term, the quarterback. So I
Yeah,
love that too.
yeah,
So yeah.
exactly. So yeah, so that's what Bruin is. We really are trying to bring behavioral health intelligence into every single primary care clinic so that doctors are able to really leverage the latest advancements in what we know clinically, scientifically, as well as all the amazing developments we have downstream. I'm sure people know there are tons of really interesting digital apps, tons of virtual care options. It's really hard to stay up to date on what's evidence-based, what's available to my patients, who would benefit from what. There's just so many decision points there. So that's really what Bruin helps you do.
That's great. And I forgot to mention at the beginning of this, I think we have the comment section. So if you have any questions, any of our viewers or listeners, if you have comments and questions that you want to send in, we can answer those on the fly. So feel free to kind of discuss with us and join the conversation. So sorry, keep going, Arielle.
Yeah. So maybe I could talk a little bit about how it works.
Yes, please.
So
what would be the workflow for a practice that uses Bruin? Talk through how that works.
yeah, so we're really sensitive to workflow, right? We know that primary care doctors are literally doing everything, and we don't want to add more work to your plate. Our goal is really to shoulder a lot of that work for you. We want to take that work on for you when it comes to your patient's mental health. So we wanted to take a workflow that you're really familiar with so that this is just easy. Like we can get started today. You can use this with any patient, right? So what we did is we really tried to make this just like ordering labs. It's really easy. We know that doctors are ordering labs all the time. Having that conversation with your patients also very easy to have. So all Bruin needs is the cell phone or email address of your patient. Okay. And then we take it from there. So essentially, you or your clinic staff just gives Bruin the patient's name, date of birth, and their contact information.
Sure.
And then Bruin reaches out to the patient with a secure link. They don't have to download anything. This is not an app, so I think that's great.
Super easy.
Super easy for the patient. They can take our assessments through this link at home, which I also think is important. You know, when we're dealing with questions around mental health, we want patients to be able to be in the privacy of their home, be able to do this on their own time, really get comfortable and feel like they can answer these questions in a safe and secure place. So they take our assessments at home on their phone or on their computer, any device, very easy. And then once it's all done, Bruin's system analyzes the results and generates a very specific care plan for the physician. What we learned is that physicians really want to be able to give the care plan to the patients.
Sure, yeah.
So we also created a patient-facing version of the care plan.
I love that they're different, right? They're not quite the same. I mean, same underlying themes, but what the provider sees and what the patient sees you want them to be slightly different, right?
Exactly, because there are things that are like clinical jargon or could come off like offensive to a patient, or they could interpret it in a way that like might be distressing. So we make sure that the physician has their version, which is really easy. It explains everything that they need to know. It's really similar to getting like an expert consult. So we summarize everything for you, tell you exactly what you need to know. We interpret everything. It's not like we send you a wall of data and are like, good luck, hope you can figure this out. And instead of that, we send a really, easy to read summary to the physicians, along with links for all the referrals where their patient can access this care, whether that's therapists, digital apps, virtual care, or even community resources. And then on the patient-facing side, it looks just like the physician side, except we've now changed the language to be an 8th grade reading level. And it speaks directly to the patient about what we found about you. There's also a lot of like validating and normalizing
Nice.
language in there to make it clear that this is totally normal.
Yeah.
We're not judging you, right? Like this is what we found objectively.
Yes.
And then it explains in like unique, specific ways to each patient why these different therapy options would be relevant for them, which I
Yeah.
think is super cool.
And I think that's really great. And again, just laying that all out is really helpful for the patient for sure, and for the provider so they can help that patient along that care plan. We
Exactly.
have a couple of questions that have come in,
Mhm.
if you're ready for those.
Oh yeah, lay it on me.
Let's see. Is the care plan created manually or AI or hybrid?
AI. So we use proprietary algorithms that we developed. This isn't like we just throw a bunch of data at ChatGPT and ask it to like come up with a care plan, right? Don't trust ChatGPT for that. All the clinical decision making is made by our system. And the way that we do that is through this very extensive curated knowledge base that we created that basically sifts through hundreds of data points from peer-reviewed clinical grade evidence. So that's how we come up with all the decision making. And then when it comes to stitching it all together and in like a narrative that makes sense to a doctor or to a patient, that's where we leverage large language models.
That's great. Thank you for clarifying.
Mhm.
Okay, another question came in. What is the cost?
It depends on the size of your clinic. So this is SaaS-based pricing. It really depends on how many physicians are going to be using the system. I'm happy to talk about it over a demo and get a better sense for like the volume that you're expecting. But in general, if you're just like a one physician practice, it's $100 a month for unlimited use. Um,
That's great.
and I
And
will just say about that, because I think it's important to realize, because what we've been talking about so far is like the case where somebody's struggling with mental health symptoms and you want to get a better sense for like what's going on with this patient, what should we do? But we've actually designed this to be relevant for any patient in your panel, which is really exciting because preventive mental health care doesn't really exist in traditional healthcare, right? Like usually
sadly,
yeah,
right?
usually we wait till somebody's having a crisis and they're like, "Oh
Yeah,
god, like, what are we gonna do?"
you're
Um,
right. Yeah.
but Bruin actually allows us to assess any patient and identify risk factors that we could intervene on now, even if the patient doesn't currently have symptoms. And that allows us to really take this proactive, preventive approach to mental health.
Yeah. That's great, and I think a lot of DPC practices would completely agree with you, right? Proactive care, right? I think I saw this on a video on your site or something, but you made the reference of, treat this like blood work or something. And so tell us more about that. Like, how often are you recommending to kind of re-up your
Mhm.
Bruin assessment?
Yes. So right now, it's appropriate to do this annually. What we heard is that a lot of doctors want to make this part of their onboarding. And I think that that really
Mm.
sets the tone that our clinic values mental and behavioral health as much as physical health, right? We do not distinguish between
Yeah.
these things, right? Like, of course, we're going to be addressing your mental health as part of our care with you. So right now, we recommend annually for any patient. For patients that are struggling and are getting a care plan, right? Where we're going with this in the near future, so not right now, but it's coming down the pipeline, which I'm really
Okay.
excited about, is we're actually going to be implementing aspects of care navigation where we can actually help your patients initiate care. We know how hard it is to make that call and get scheduled and like make sure the therapist is taking people and like that whole process is painful. So we want to help patients with that. And once we know that patients are initiating care, we will do outcomes monitoring. So we'll make sure that you're actually seeing improvements in your patient's mental health through the care plan. And if not, figure out what needs to be changed so that we can make sure it's working.
Oh, that's so powerful. That's so powerful, and I'm going to, echo a comment from Julia. "This is brilliant," she says. So, I love it. It is brilliant. I really again, I love that. Coming down the pipe, right? So, we'll keep, our Hint community updated when Bruin is making these updates so we can all kind of take advantage of these great features and, new aspects to this. So I had a question, but you kind of covered some of these as well. So one of my question was, what's the ideal patient for a DPC doc to be using this with? But really, it's everyone. It's all of them.
I would say it's everybody. I think that everybody should be getting annually checked. I think it should just be a gold standard that we do a mental health checkup every year just to check in on how you're doing. I also think that that really helps kind of lower or reduce or hopefully just get rid of any kind of stigma around mental health, right? This isn't a comment on your character or something is wrong with you per se. Mental health struggles are things that we all deal with, and we are all at risk for. And I think that if physicians are implementing this in the way that they would do just a regular blood work annually to check on your levels, make sure everything's good, I think that really helps kind of normalize mental health care as well as make strides towards taking down this artificial barrier between mental and physical health care. So it really should be annually, although I will say where we really shine is where patients are struggling and it's not really clear what's going on. We don't know what diagnosis this patient might have, or maybe we don't know how severe it is. Sometimes physicians think it might be depression, but it could actually be bipolar disorder. And if we don't really assess for past manic episodes, it could be dangerous to prescribe certain medications. So I think just getting that additional information so that you're more comfortable with what you're doing around mental health is also great. And then for patients who might be already going through treatment, but they're not improving, so you kind of want to get more resolution on what's happening. And then also for patients where you do know that they need to go see a specialist, but maybe they can't get into a specialist for another 6 months because we know that there aren't that many psychiatrists out there. This is something that you can do with patients in the meantime that helps support them while they're waiting.
Yeah, that's great. That is, because sometimes it takes a while. So this is really helpful. Let's see. So you mentioned some kind of evidence-based therapies and interventions. Do you want to tell us more about that?
Yes. So right now, I think the best that doctors can do, unfortunately, is say things like, you should go to therapy.
That's too generic. What does that mean?
And I think a lot of doctors and patients don't really know what that means. And so patients, because they're not educated consumers of mental health care, they'll end up in what are called supportive therapies, or they're not really getting what's called an evidence-based practice, meaning they might end up going to a therapist for an hour every week for years, which is not the goal, right? The goal is to go learn the skills you need and help you get out of therapy so that you're in a better spot. So what we actually do is figure out what evidence-based practice your patient might benefit most from based on their results. So for example, I'm sure a lot of patients are presenting with anxiety. I think that that's very common, but there's a lot of different reasons why somebody might have anxiety symptoms. And there are a lot of different ways that we could treat anxiety. So for example, if somebody's actually dealing with anxiety symptoms that are more due to a trauma, something that's more related to PTSD, they would benefit from something called cognitive processing therapy. Whereas if somebody's presenting more with OCD type anxiety, they have these repetitive safety behaviors that they're using, they would benefit more from something called exposure and response prevention therapy. So these are two exposure-based therapies, but very different use cases.
Yeah.
So we can identify which ones of those your patients would benefit from, and also figure out which therapists local to you practice those therapies and are taking new patients, where they could get that care virtually, as well as digital apps that might be supportive during that process.
Oh, this is so helpful. So helpful. And I just feel like it's just so easy to insert into a DPC because it's just so customized to the patient themselves, right? It's so specific and so individual based on, the assessment. And There's another comment here that I love, and I forgot to mention, I loved the onboarding idea, like you said, but Xavier said, and it helps align with the annual physical for workflow / habit building on both the provider and patient ends. The annual
100%.
physical. Yes, this is just so easy. It's such a great fit for all of these practices that are doing this in such a complementary service.
Exactly.
I love that. Great idea, Xavier. Let's see. I have another question for you. So when we get these plans back, the patient version and the clinician version, what if the practice has some questions? Can they reach back out to Bruin and ask and kind of go back and forth? Tell us more.
Absolutely. So we really do want to be your partner in sharing on this workflow, right? We want to be your trusted partner when it comes to mental and behavioral health care for your patients. So if there are ever any questions about our care plans, we try really hard to define everything, spell it out very simply for you. But if there are any terms or any questions that you have, you can always reach out to us. We're always available to answer any questions around what things mean, as well as next steps. We really do want to be your partner there so you don't feel like you're doing this alone.
Yeah, that's great. That's what everybody wants to feel, right? Yeah. We're in this as a community.
Exactly.
I love that. Do we have any other questions from our viewers or listeners? I feel like this is a very pivotal moment. You have Arielle here. Ask questions while you have them. This has been such a great conversation. And again, I know that so many of our docs can benefit from using Bruin. I think this is going to be such a compliment to what they're already doing. If we don't have any other questions, Arielle, what else do you want to say? What last minute things you want to throw in here?
So I do want to plug that we do a 1-month free trial.
Oh, great.
Which is really important because we want you to get a sense for what this is like to use with your patients, and make sure that it's a good fit. I mean, we're really confident in the experience that we want you to try it out. We really want everyone using this. So if you are interested in learning more about that and wanting to sign up, it's super easy. On our website, there's a link where you can schedule a demo with me through Calendly. Super easy. Just find a time for 20 minutes that works for you. I'll answer any questions that you have. And if you want to go ahead and try the free trial, we just sign something over DocuSign about that. And then I get you set up and you can start referring patients as easy as today. And we
value. Take advantage of this.
And we get care plans back to you within 48 hours.
Oh, that's great.
Within 48 hours of a patient completing. I will say, just so that your patients get kind of like the right expectations, it takes around 30 to 45 minutes for patients to take our assessments at home. So we do a really, really deep dive. What I think is really cool is that 75% of patients that are referred to us by their DPC finish the entire assessment. So I think that says something. I know how you're probably all like, oh, I can't get my patients to do a PHQ. They're never going to spend 45 minutes taking all these assessments. And I think that they do it because we ask questions that are really insightful, and it helps patients understand why they feel the way that they do. So it's a very different experience from just reporting on like, I don't feel happy, right? Like, I think patients are like, I could just tell you that, like, I don't know why you need to answer these questions. So yeah, it takes 45 minutes for the patients, super easy to refer them to us. Once they finish, we send you back the care plans, and we're always available to answer any questions you have about them.
That's great. And maybe one more question that I have that you've pretty much covered already, but just to kind of bring it home. What about how can practices or clinicians kind of approach these conversations if it feels like maybe it's, conversations that's a difficult conversation? What would be your best tips and tricks?
I think it's a really unique opportunity to normalize mental health. Patients and doctors wouldn't think twice about a doctor being like, you know what, I think we need to order some labs to get some more data points so that I understand what's going on with you and we can treat this more effectively. Yeah. I think doing that exact same thing, but for mental health, really communicates that we don't distinguish between mental and physical health care. Of course, I want to get some objective information to know how best to treat you, as opposed to just saying like, go find a therapist, and they might do something for you.
Maybe.
Yeah. So I think it really helps. I think patients really respond well to this idea of normalizing mental health. And I do think, again, like just making it part of onboarding and just having everyone do this really helps communicate that this is just part of your healthcare, right? Like this is not anything different from if you were experiencing, fatigue and we wanted to check, your adrenals or something. We're going to go get a lab test. Of course, we want to get some data to figure out how best to treat you and your mental health.
Yeah. That's great. I love that. And I love all the work that you're doing to really, like you said, normalize and make this just part of our routine, right? Because this is so important. One more question from Julia. How would referrals to psychologists/therapists work to make it easier on the patient?
Yes. So we include specific links to therapists that are either available locally or online who practice that evidence-based therapy and are available and taking new patients. So patients just click on the link and it'll take them to that exact therapist. Like I mentioned, we do have care navigation coming down the pipeline where we get a little bit more involved in that, actually help doing the scheduling and figuring out, which therapist you want to go to, figuring out a good time for your appointment. We really want to help handhold around that. I think that people don't understand how hard it is to initiate care. I think that's like 30 to 50% of patients who get referrals into outpatient mental health care from their primary care doctors do not initiate the referral. And I think it's because the barrier of having to make those calls and like get the appointment scheduled, it's just a really big hurdle.
It's just too much.
Too much. It's like I got too much going on and I feel like crap and I don't want to do that. So whatever we can do to help the patient with that, that's where we're going.
That's great. That's great. Okay. Here's our link. Learn more about Bruin. Oh, maybe one more last minute question. Somebody got it in. Do the providers get that? Get that like as well to help navigate?
The link, yes. So the physicians and the patients get the exact same information. It's just the way that we introduce it and talk about it is different for a physician and for a patient. So it's a shared decision-making tool. Everyone has the same information.
Gotcha. Okay. Perfect. Okay, now here's the link to learn more about Bruin. I hope that you can all find what you're looking for, and Arielle can help answer those questions. And as she mentioned, schedule a demo with her to ask specific questions. But we're so happy to be partnering with Bruin and so just supporting the work that you're doing. We just love all the normalizing of behavioral health, mental health, and just it's good for everyone. So thank you so much for joining us today and telling us all about the good work that you're doing. So thanks, Arielle.
Thanks, everyone.
Thanks, everyone, for joining. We appreciate it, and we'll see you next time.